Good morning, everyone. Richard.
Yeah, good morning or good evening to our overseas attendees. We're delighted to have over 300 people registered for this event today. I would like to welcome you all to Pavee Point's webinar to mark Mental Health Week. My name is Bridget Quirk. I'm your moderator for today's event. The theme of World Mental Health Day is greater investment, greater access, which we feel is quite in keeping with our event today. Our overall aim is to explore the mental health impact of racism and discrimination on ethnic minority Indigenous groups. Our objectives are to explore the impact of racism and discrimination on Aboriginal Australians, mental health, and to draw parallels with the experiences of travellers in Ireland. We also want to set out why and how discrimination should be recognised, acknowledged, and addressed by mental health service providers in Ireland. Now, just for a quick introduction to our event today. Firstly, Patrick Riley, Traveller Mental Health Worker, and Grania Meehan, Coordinator of the Mental Health Initiative, who organised this event today, will give you a brief overview of Traveller Mental Health in Ireland and their project. We then have a presentation from our distinguished guest, the speaker, Professor Jan Paradis, who I'll introduce in more detail later. After his presentation, we will have an opportunity for Q&A, questions and answers. So I would encourage you all to use the Q&A box for comments and questions, which you will see at the bottom of your screen. This will help to make the webinar as interactive as possible. And you will see on the slides that we also have hashtag WMHD, hashtag Trav Mental Health for you to use to tweet during or after the event. Now, I would like to hand you over to Patrick Riley, who is a traveller and a mental health worker on Pavee Point's mental health team. Thank you. Patrick.
Thank you, Bridget, and good morning all. So as Bridget says, I'm going to give a brief overview of traveller mental health, and we're going to speak to, and you're looking here now, at factors leading to traveller mental health distress, self-harm and suicide. So we know there's a lot of issues that impact on travellers' mental health, but the theme of today, we're going to be looking at discrimination and bereavement. So some of the findings you see here from the All-Ireland Traveller Health Study are over 50% of travellers have experienced discrimination in their daily lives. And if you look at the third one there in particular, over 66% of service providers agreed travellers experience discrimination in the use of their health services. And only 41% of travellers had complete trust in health professionals compared to 82% in the general population. So we're just going to move on to the next slide. And what you see here is factors leading to traveller mental health distress, self-harm and suicide. So you can see that suicide accounts for 11% of all traveller deaths. The traveller male suicide rate is 7 times higher. You can see infant death rate, adult mortality. Traveller women live 11 years less than settled women, and traveller men live 15 years less than settled men. So if you look here at the All-Ireland Traveller Health Study, in 2008, all things being equal, there should have been only 54 expected deaths. There was 134 excess deaths, in total 188 observed deaths. What you see in this graphic are numbers. For me as a traveller, what we see and hear this all the time on the ground. And these are traveller men, women, children, uncles, aunts, brothers and sisters. And when we look at these stats, no community, let alone my community, should have stats this day and age that high. Thank you. Back to you, Bridget.
Thank you, Pat. Good morning, everyone. My name is Grania Meehan, and I'm the coordinator of the Pavee Point Mental Health Initiative. The Mental Health Initiative team comprises of myself and my colleague Pavee and Geraldine McDonald, who are both traveller mental health workers. This initiative was established to work on travel and mental health issues identified through Pavee Point work and research. Some of these issues have already been highlighted to you through the short video of a Grow Boxes exhibition just before this webinar began. And I think that there was a small issue with the sound as I started playing the video, so apologies for that, but we will be sharing the video with everyone afterwards so you can have a chance to watch it again. So just to give a short overview of our work, the Mental Health Initiative works to improve mental health for travellers in Ireland with an emphasis on traveller access to mainstream mental health services. We work through the Eastern Region Traveller Health Unit with 9 traveller primary healthcare projects across CHOs 6, 7 and 9, covering Dublin, Kildare and Wicklow. Our work reaches approximately 8,000 travellers, or 26% of the travel population in Ireland. There are four strands to our work focusing on addressing mental health issues among the traveller community. Firstly, we work to keep travellers well by maintaining and promoting positive mental health and well-being. And a recent example of that is our Minding Our Old Pavees postcard that are a resource for traveller primary healthcare workers and can be used to promote well-being and positive mental health with older travellers. Another example is a culturally appropriate resource we produce to promote positive mental health and respond to the stress related to COVID-19 impacting on travellers. Secondly, we work to facilitate traveller access to and outcomes from mainstream mental health services. And two examples of this are a recent culturally appropriate resource providing advice to travellers who may be experiencing suicidality on steps that they can take and support that are available to them. We also produced a leaflet on pathways to mental health services during COVID-19, which you can see in the screen. Thirdly, we focus on developing culturally competent and appropriate mental health services. In terms of culturally competent services, a recent example of this is our partnership with Pavee, where we developed an online module on travel and mental health, which is available to approximately 300 or more volunteers. We also developed a traveller-specific campaign, which you can see on your screen, encouraging young Pavee to mind their look, their mental health, and use cyber ways if they need to. We encourage young travellers to text Pavee to cyber because in the absence of an ethnic identifier embedded widely in mental health services, we have very little information about how many travellers are using or not using mental health services. Through this innovative keyword partnership with Pavee, we hope to have more information available to us on this. And finally, we seek to carry out research such as that of our young Pavee's mental health research and to impact on mental health policies and services through developing submission, for example, to the Elected Committee on the Future of Mental Health Care and key issues affecting travellers. And before I wrap up, just to say all the materials I have referred to today are available on our website. And now I'll pass back to the moderator, Bridget Quick. Thanks, everyone.
Thank you, Grania. For a very illustrative presentation, I think, highlighting some of the factors contributing to the current mental health crisis in Ireland and for some of the innovative responses that you're involved in. Now, before I introduce our guest speaker, Professor Paradis, just a quick reminder to put your questions in the Q&A box during the presentation. We won't be answering live, but we will endeavour to get through as many of them as possible in the session. We will follow up with information and post relevant research on the website after the event. Now, I'm pleased to introduce our guest speaker, who we're very fortunate to have with us today, or in his case tonight, as it's 8 p.m. in Melbourne. Yin Paradis is Professor and Chair in Race Relations at Deakin University, Melbourne. Professor Paradis conducts interdisciplinary research on the health, social and economic effects of racism, as well as anti-racism theory, policy and practice, and race and intercultural relations. He also teaches and researches in the area of Indigenous knowledges. He has written prolifically in all these areas and has over 300 publications. This is Pavee Point's first association with Professor Paradis, and we look forward to future collaboration. Professor Paradis will be speaking with us about the mental health effects of ethnic racial discrimination on the health of Indigenous peoples. Good evening, Professor Paradis, and thank you for agreeing to share your research and experience with us, and I'm looking forward to your presentation.